Mom, I know I have to do this for myself, but I'm so scared, and I don't know how I'm going to ever cope without my eating disorder.
It's okay, sweetie. I know you're scared, but it's going to be okay. I love you.
It's heartbreaking when I first see some of the patients that come with their families, and they have almost just given up hope because, you know, the patient has tried to control this eating disorder, and they keep thinking, well, tomorrow I'll get this under control, or the next day, and it keeps on going on day after day, and they can't get out by themselves. And then the parents are in the same position because they want their loved one, you know, to recover from this eating disorder, and they try to do all the things that they can to help them because they love them so much, but it really, you know, it's usually not to avail. Professionals and a professional team really needs to be around the patient to help them to find the underlying reasons. The eating disorder usually starts to appear around adolescence, and that's what we see with most of our patients. Now, there are many reasons why an eating disorder occurs, but most of it has to do with using the eating disorder as a coping mechanism. They're actually trying to deal with the stresses in their life and in their mind and in their body by focusing on something else. And that focus may be, you know, their body image. It may be perfectionism, just trying to be perfect. It may be, you know, food, diet. They're obsessively thinking about these things, but it becomes a habit in that they're using that to actually divert them from the feelings. So they don't even know, you know, what is propelling the eating disorder because they have used this as a way of coping for so long. Along with the core of our program, our patients also benefit from many other modalities of treatment. We have dialectic behavioral therapy, cognitive behavioral. We also have many groups for self-esteem, process groups, art, equine therapy. We also have times where they're getting education about the disease or the disorder, and also about nutrition and how that's affecting their body, mind, and emotions. So they, in addition to all the groups that they attend during the day, they also meet regularly with their primary therapist, the registered dietitian, the medical doctor or psychiatrist, or the nurse practitioner. And there's always someone around here who is always available if anything comes up. We really care about our patients.
One of the true blessings of recovery is that I'm able to give back what I got so freely. And I have the wonderful opportunity to come to Rebecca's house every once a week. Not only is it such a blessing for me because I can put myself in these young ladies and middle-aged ladies' shoes, and I totally know where their life is, and I can you know, just feel for them and know their journey. And the beautiful thing is, I can give them some hope. I can show them that there is a life after recovery. It is truly worth, you know, investing in treatment and the incredible work they do at Rebecca's house, from not just the, you know, just the therapies and tools that they teach us, but just you know, their humanity and their caring and their love, you know, for, you know, patients and clients that are struggling with this. And so I really see myself as a success story from Rebecca's house. And so I love to come here. I love to sponsor girls here and help them on their journey of recovery and you know, just be able to proclaim themselves as successful in recovery from Rebecca's house. So.